everybody, and welcome to the Code Clarity podcast. I'm Rena.
And I'm Jean. Today, I want to talk about engaging patients to provide services to pharmaceutical companies and looking at the what, the who, the why, the when, and the how. So, Rena, starting with the who. Who is a patient?
Yeah, and that's actually a really fundamental question that I think lots of companies still struggle with. Patients is used in a couple of different ways. There's the broad sense of patients, but then there's the narrow definition. And the narrow definition is someone who is receiving a specific company medicine. So someone who's been prescribed that medicine. And what we're going to talk about, I think for the purposes of clarity, are those patients only.
Okay, so it's just patients who have been prescribed your medicine. That's it's not people with the disease, yeah?
Yeah.
Okay, so yeah. Okay, so why would pharmaceutical companies want to engage with patients anyway? And what can they do with them?
Yeah, I mean, there's just so many pros that far outweigh the cons when a company is engaging with a patient. And very different to patient organizations or members of the public. So they can be used at meetings to either chair or train. They can create case studies. And I think that is something, Jean, that we probably need to go into in a separate podcast about the use of patient case studies.
Yeah.
They also used, interestingly, to input into promotional campaigns, into medical aid education programs, patient support programs. So there's absolutely shed loads that can be done. But what do you think about the when question? So when is it appropriate for a pharma company to use a patient?
Yes, I mean, as you said, there's lots of reasons why, but I guess the most important when is that you've actually got that need. So you've actually got the why. So once the why's in place, the when kind of falls out of it. So as with lots of things that pharmaceutical companies do, you need to be able to demonstrate that you actually have a legitimate need for doing that activity. It needs to be identified, it needs to be documented. I have to say, there is a lot of paperwork involved in making sure that you do things correctly. And the when as well, and I guess it falls into a little bit of the back into the who, is that the patients that you're engaging with, you need to make sure that they are appropriately qualified to be able to fulfill that need. So you've said, we have this need. It's best fulfilled by engaging with a patient, and this patient that we choose to engage with is best qualified to meet that need. So
I agree, and I think sometimes there's a fine line. Sometimes I hear fluffy reasons for the need. It's got to be a really strong justification. And in some disease areas, like rare disease, patients are just so well educated. There's a fine line between, do we go to a healthcare professional or do we go to a patient? So only companies are going to know that. What about the how? What about the nitty-gritty of how do we actually engage these patients? What needs to be in place?
So, I mean, the how is obviously we need to make sure that patients are treated fairly. It needs to be on mutual respect, one of the 4 principles of the code. We need to make sure that we respect the independence of the patients, that we might use their insights to feed into a promotional campaign, but we certainly shouldn't be trying to get them to actually promote our medicines in and of themselves. We need to respect their independence, obviously make sure it's all ethical and professional. And the way that we usually ensure all of that is met is by as I've said before, the paperwork, making sure that there's an agreement in place that sets out very clearly, this is the requirements on our behalf, this is the requirements on your behalf. And if we're going to pay them, you again need to make sure that that is a fair and reflective of what you're doing. I mean, what do you think is the top tips of how to engage with patients?
I think it falls down to 3 top tips. So firstly, we should absolutely be doing it. I think there's no good reason why all these pharma companies with mission statements about patient-centric are actually engaging with patients around. Secondly, I would say that we must know the risks and mitigate against them. There's no point sticking a finger up in the air and just hoping for the best, because everybody knows that doesn't work. And thirdly, yes, there is paperwork. There's paperwork with everything that we do, though. That doesn't prevent us from doing it. So, yes, you've mentioned there agreements and remuneration, which means we're looking at SOPs and stuff. But, briefs and agreements is nothing new to us.
Yeah.
The other thing I would say is that the last code did bring in requirements around disclosure. So
Yes.
that's probably something new, but again, not insurmountable. It's pretty easy. We're not even disclosing on a named personal level. It's just on an aggregate level. So three very clear top tips for doing it.
Yeah.
Anything else you'd like to add?
No, I think I just, agree with that. The most important top tip is, yeah, pharma companies should be doing it. Absolutely. And making sure that their processes allow them to do that effectively. Yep. Thanks very much.
Cool. Thank you. Bye.
Bye.